Good morning, or afternoon, or evening, depending where you are around the world. And our panelists are located in all three of those time zones. This session is going to focus on a roadmap for building a CX-centric organization. You know, as we've all been working to differentiate based on customer experience and building a data-driven operations, we thought it'd be interesting to bring together leaders who are helping reshape their organizations around the customer and think about what roles to redefine or upskill and import talent to ensure future success. You know, the introduction of customer-centric roles has the potential to rejig the traditional org structures today. And we're going to look at that change happening or plan to happen in roles in headquarters in the customer-facing world, and then how that interplay is important to changing organizationally. My name is John McCarthy. I'm a principal consultant with DT Consulting. I previously had been at AstraZeneca and put 30 years there and did a number of different jobs, including running the digital function for a number of years. I'm blessed this morning to have panel members with me that are really in touch and driving this change within their organizations. Narissa Gomes is the Executive Director, Global Customer Engagement and Digital Capabilities at Amgen. Importantly, I think for our discussion today, she's also very involved in a comprehensive program called Customer 360, which emphasizes building capabilities to address customer needs. So it sounds like we got the sweet spot for Narissa. Debraj Dasgupta is founder and CEO of Healthtron Private Limited and H Drive Consulting. He is, well, many of us were seeing businesses fail in the pandemic. He started two of them and returned to India for that. He formerly, though, was the global head of strategic portfolio and market management at Biocon and had a number of strategic positions with BI and Novartis, and leading him through Germany and Japan in those different roles. So some good international perspective from Debraj. Ken Coyle is Vice President of Business Operations at Insight. Previously, he was at Radius Health as VP of Strategic Commercial Planning and worked together with me, where he taught me everything I needed to know about commercial insight. And he had a number of sales and marketing roles beyond that as well. So thank you guys for joining the panel and sharing your ideas. I will make a point that they are sharing their ideas this morning as opposed to, you know, the opinions of their respective organizations. And you're going to see a blend, I think, of thinking across roles and companies from their input. But we're blessed to have a group like this together that can speak to it from different angles, from different therapeutic areas, and from different market perspectives. So let me kick off maybe with Narissa, and just thinking about how your organization has changed already when it comes to customer experience.
Thanks, John, and hello, everyone. Thank you for the opportunity, and it's really nice to be joined by the panel that is here today. Look, in my opinion, I think for Amgen, this is not new. We've been on this journey, as I'm sure many other healthcare companies have been, to redefine what we do and how we do it to drive a better customer experience. So for us, I would say there is probably three areas that we primarily focused on. One, I think, is really building that customer-focused thinking. So how do we, when we approach whatever we do, no matter if it's in the field, marketing, medical operations, really putting the customer-centric thinking around how we build our strategies, design, and execute against them. I think the second thing organizationally we've done is really try to remove redundant layers between what we build for our customers and how it lands on them. So really trying to think about reducing the number of layers between the build and when the customer actually experiences our product. And the third one is tied to, John, what you articulated in the intro when you talked about my role. I am part of a team called Global Customer Capabilities, and what that is Amgen sort of made the decision to say, how do we really centralize some of our capabilities when it comes to building or engaging with customers, whether it's data analytics, digital, et cetera. And the idea behind that was really to sort of one, make sure that no matter where a customer is when they engage with Amgen, whether it's across brand, across country, across region, how do you deliver a similar customer experience? So if we can really centralize the capability that can help drive a more customer-centric experience across all of the patients that touch our products, or the other customers too. And the second piece in doing that is it really allows our local teams, who at the end of the day are the ones who are closer to the customers, to really focus on the strategy and execution. So some of the back end systems, capabilities, data and analytics live centrally, but it frees up our local teams to really be more focused on strategy and execution closer to where our customers are. So those are some of the changes that at Amgen, I believe we've made to be more centric from a customer experience perspective.
That's great. Debraj, you want to weigh in next?
Yeah, absolutely. I think having been in the trenches of organization transformation, much like Nerissa until recently, and then taking a bird's eye view in my consulting role at this point of time, I do see that, just building on what Nerissa said, I think the organizations have changed significantly in terms of their thinking about customer experience. But I think it would be amiss to say that one of the biggest drivers of transformation we are seeing now is how customers have to, or how pharma companies have to respond to customers in the pandemic situation. Because I think we'll all agree that the pandemic over the last year and a half has been a big accelerator as it relates to capabilities like remote interaction, making sure that we can quickly pivot from a face-to-face model to produce agile content and meeting customer needs. So I think there's been a lot of thinking in terms of what that customer experience looks like, and then how that shapes our future in the next 5 to 10 years.
That's good. Ken, you've had an interesting perspective with a couple of different companies in the last 4 or 5 years, I think. So how are you seeing it play out at Insight?
Yeah, it's really interesting because I think to both Nerissa and Debraj's comments, part of it is internally driven, and obviously externally, the acceleration is probably a great way to refer to it. I think one of the things that's really interesting about it is that it's we're kind of at the opposite end of size. So we're not as big as Amgen, and we're one product company or maybe 1 or 2 products until recently. And I think what really has been a major driver of it is internal capabilities that allowed us to gather the data together and the information in one place, but then also the need to evolve, right? So what got us here with one of our products that was our main driver, we now have to figure out, okay, how do you handle all of those customers when you're in a world that you have co-promotes, you have 2 franchises now, you have multiple products. And so, I think that actually my predecessors, because I haven't been in the role that long, were really the architects of that at the beginning of it. And I think what they really saw was that there's a great advantage to the size that we have in that we can move things more rapidly. We can work across boundaries with our marketing teams, with ops, with the medical affairs, all those different teams to try to say, what is it that we want? So I think ultimately it all starts with the idea of it being a philosophy of change that we want to engage in, and then really coming behind that with the right tools and people and things like that.
Great. So let's get to maybe some specifics, like what roles have, and Debraj, if you can start us off with this one, can you give me examples of roles you've seen created that are fitting into this new execution?
Yeah, so having been on the journey for the last decade or so, and having been involved in the rollout of the first iPads and the first CRM systems, right up to the point when we have all the omni-channel capabilities, I think there's a lot of roles that have been created which didn't exist before. I mean, the commercial world used to be simple. It used to be the brand teams and it used to be the sales teams. But I think we'll all agree that within our teams, as we have added these new capabilities, there's multiple roles that have been created. And I'll speak to some of them. When we have, for example, gone on the journey to improve and increase our tech stack, the marketing tech stack is not simple anymore. It's become complex. There's multiple layers to it. We've had to create roles like platform managers. And, some of these platform managers provide governance of platforms. They are sitting at the interface of marketing and IT and looking at how these platforms are nurtured and developed and trained on across the organization. Alongside, content has become a big thing, and we are creating lots and lots of digital content, but we often find that you have to create content teams that sit side by side with marketing teams in order to help support this whole content ecosystem. So we've had to create roles like content managers. And then on the analytics side, as we have moved from secondary and primary market research into more of advanced analytics and data science, we've had to create data scientists, for example, and that have had to come in the organization and sit side by side with traditional primary market researchers. So these are just some examples of roles. I'm sure Ken and Nerissa have others that they can speak to in their organization, but I think what we are seeing right now, and even in the field force, right, we are talking about a traditional sales rep, a hybrid sales rep, a remote sales rep. These roles are evolving and changing, and I think it would be hard to say what kind of roles we'll have in the future. But I think we're seeing a lot of roles that are being born at the interfaces between marketing and medical, marketing, market access, and marketing and IT. And these roles are increasingly playing a very important role in driving and shaping the overall transformation.
Interesting. Ken, what have you seen? Maybe even some of the new indications or launches has created new roles for you as well. What are you seeing?
Yeah, I think part of it has been not just new roles, but how the roles work together. I think when we take a look at any of these pieces, none of them. I think traditionally people used to work a little bit more in silos than they have more recently. And the reality is that in order for us to really maximize the value of the analytics and the predictive work that's done, we really need to have the buy-in across it. So you have to have sales leaders who believe in it. You have to have marketing teams that are creating content and those things. So one of the things that organization has done is we actually consolidated roles where we said, okay, we need to have a central place to run this from. As we bring more brands into the fold, rather than everybody going off and doing it separately, we'll have a dedicated analytic support, we'll have a dedicated operations role. And they are really incredibly important for consistency, for how we interact with our agencies like Indegene and agencies of record as well. So for us, that was probably a pivotal point. And in some respects, it was consolidating it, moving it out of brands necessarily. Like they're strategy drivers and creators, and we're there to ensure that the operational side of it really gets done well.
Great. Nerissa, it seems like a lot of what you're focused on in the remit is around what new should be there. So, and I'm going to come back to you here next. So if you want to blend the questions about how are analytics being repositioned within the organization? And I think all three of you have some depth in that area as well.
Yeah, sure. Happy to provide a point of view. I think I wholeheartedly agree with everything that both Debraj and Ken alluded to. I think in terms of new roles, the one other one that comes to mind is this idea of customer experience design. That's not something that traditionally we have in pharma, and it's something that I know we've started to really focus on, so bringing that acumen. I also agree with Ken on it's not just about new roles, it's really evolving existing roles. So as a marketer, historically, you were very focused on a single channel, whether it's a face-to-face interaction or building a TV campaign, to now really thinking across channels. That's new, and that's it's not very new, but it is newer, and it takes a different acumen. And then everything that Debraj talked about in terms of sales, the selling model is very different. It's moved from, I think, in my opinion, from selling to how do you compliantly support customer needs? And that means you might be, informing on the product, or you might be helping with access to the product, or office support and things like that. So a very dynamic evolution of roles across the various types of roles that exist in our companies today. From an analytics perspective, I think there's three areas, and actually Debraj covered on most of them, so I'll just briefly summarize, in my view, what I think when it comes to analytics. One is data. How do you build not only a robust access to data on your customers, but how do you connect them so you can really create that connected, integrated understanding of who that customer is, so that everyone has that same shared view. So when they interact with the customer, they're all speaking the same language, right? That's really important. The second is insight generation engine. So I think we're blessed with lots of data, but that also means that it takes a lot to find the insights that you really need to action upon. So having a capability within your organization that can really crystallize the insights that your field customer-facing teams, whether field marketing, medical, et cetera, can action upon. And the third, I think was already covered, is this idea of really leveraging AI and automation to almost drive machine learning actions that can help improve that customer experience. So those are some of the areas that I think are critical when you think about a data and analytics capability within your company. But I'll let Ken and
and Narissa, the only thing I would add to that, because that's pretty much the same thing, is I think what's interesting in terms of analytics is actually learning the nuances, the small details of how the digital world works. I think one of the things I've seen in our organization are people who spent their discretionary time to truly understand what every code, every click, every element of that, because you become a much more informed consumer of that, and you realize the quality of your data is completely dependent upon what is designed into the offering to begin with, and what you get out of it. And so it's been an interesting process, because it makes you a better partner, I think, with companies like Indegene or PHM or whoever it is that you're buying your search capabilities or other things from.
Anything to add, Debraj?
Yeah, the only thing I think Narissa and Ken covered it all. I think the key one I would like to say is there is a lot of realization happening now within marketers that there is a much more bigger role that content plays in terms of this whole analytics piece. And I think there's this notion that when you are sending out a piece of content to your customer, as important as communicating a message, it's also important what you learn from customer behavior in terms of how they interact with that content. So content tagging, content analytics, I think these are important capabilities that are coming out and then become the principal tenets of designing that customer journey, if you will, in terms of driving real customer behavior. So I think how that content interplays and how we do advanced things like A/B testing, UX research, et cetera, on our websites and channels is becoming a very important thing. And so I think the broader message here is analytics is bread and butter for every role, right? You may be sitting in medicine, marketing, core analytics function, but I think everyone has to become part of that data-driven marketing machine. Otherwise, you just are not learning about how your customers are behaving and interacting with you. And that's a big miss.
Good. And so, so that we're talking about, I think, a shift in how marketers have to interact and deliver their work. So how are they positioned to adopt these new ways of working? It probably is too overused term, but the analytics integration and the test and control environment that's available to them, are they making the flip, or is there a good path for them? Don't remember who I talked to last, so Debraj, keep going.
Yeah, I can. So basically what we are seeing across companies is that the sudden shift and the pivot to a digital first world has been for the traditional brand team a learning journey. So what most organizations have done is they've taken a digital native team and put them side by side in marketing. Sometimes they report into marketing, or sometimes they sit side by side in a multi-channel or a digital team. But I think what we would see in the next coming 3 to 5 years is marketing teams in pharma that look more like FMCG teams, right? That you have an advanced analyst and a very advanced content manager and a traditional brand manager who's sitting side by side, and they're making decisions about marketing budget. Because where we started with, we saw that there was a kind of silo where, let's say, the traditional face-to-face activities in terms of CMEs and the detail aids were all sitting under the marketing budget, vis-a-vis the digital teams were kind of taking charge of websites and other channels. And I think slowly we are seeing a merging of this. And so I think what we are ready for, and I think those organizations who make that pivot earlier have a bigger chance in winning the competitive game, is basically creating that future marketing organization with all of these roles built in.
Good.
Yep. Maybe if I may, I think in addition to everything that Debraj outlined, I also do recognize, at least what I see in when talking with people in the virtual halls of Amgen, is there's a recognition. I mean, marketers are not sitting in isolation. We're consumers ourselves. And so there's I think a very good recognition within the organization and people that I talk to of this is the new way we all have to operate. So there's this leaning into the change, which I think is number one. Number two is training and really helping them with the capabilities and competencies that you need to be successful in this new ways of working, as you mentioned, John. So I think it's very critical that we help them. And then Ken alluded to this already, solutions and systems, technologies that can help make their jobs easier, because they have to be more savvy with the data. They have to be able to deliver better content that requires, systems and partners like Indegene, for example, to help make, marketers be more successful in delivering that content that can really catch the attention of the user that they're trying to get to.
And John, one of the things I think that is really important too is actually having buy-in from high-level individuals in the organization. It's interesting because oftentimes, you can have the passion or somebody who really believes in it, but I think we've been pretty deliberate about proving the value and getting people bought in as they go along, which in turn leads you to sort of evolve how you work together. So, if you're not just going, hey, I need a commission on a primary market research study, instead, everything becomes very iterative. And it actually, I think Dr. Legoff actually wrote it down and said intervention, measurement, and then adjust and correct. And it's that same kind of iterative world that you live in, where it's not like just get it all stood up and then it goes out and kind of you see how it works, but it's constantly testing, evolving, whether it's taglines, whether it's the intro lines in emails, whatever it may be. But it really starts with the belief that everybody is going to support that within the organization, and everybody believes in the value that it has.
Great. Sounds like my golf game, Ken. I keep testing things and it doesn't work, so I keep testing something.
It's belief. It's all belief.
So let's flip more a little bit, kind of get into some of the customer-facing roles. And there's a I have said on more than one occasion that our customer-facing roles ought to be part of omnichannel. Is that where it's going? That's John's opinion. Or is it amplifying those customer-facing roles? And I'll kind of let this be a bit of a free-for-all when it comes to, we have sales and key accounts. We have the medical. There's reimbursement or payer roles. Are there new customer-facing roles, or how are we interacting with these different ones? And maybe Narissa, I'll start with you and see how this is evolving within the Amgen world.
Yes, again, I think as I mentioned earlier, I think the evolution of how customer-facing roles has changed is something that we've been on for a while. And, I don't want to age myself, but I have carried the bag a long time ago. And I remember being a sales rep and really wanting to lean in to really helping the customer, and by customer, in this case, I'm talking about the provider in many different ways. And I think what you're seeing is a recognition of how important that is. And so you have these varied roles, as you mentioned, the account managers, the reimbursement reps, the product support facing teams as well. In addition, because of COVID, it has been accelerated, although I would argue that those have also been around before, but you are seeing an increase in the virtual rep models and virtual engagements. I think, again, I don't know exactly how the industry is going to play out, because I think we're still in the early days yet. However, I will say that the importance of the face-to-face engagement is still very, very relevant. And I think there's data done by IQVIA, McKinsey, a bunch of big market research companies out there that have shown that is very important. So that's here to stay, and it's something that we absolutely have to continue to foster and build. But the amplification of what that looks like, as you talked about, John, I think is where we're headed. And I think that's where, if we can really get more successful in integrating that face-to-face interaction with the surround sound that digital and virtual interactions provide, you start to get you start to see the impact on driving that customer experience and improving patient access. So I think it's really about getting our sales reps and our other customer-facing teams to work more closely together. So the integration with the field-facing teams, and then leaning into the digital solutions that exist that can amplify that experience. But it's also very, very important to be able to deliver the right content at the right time to the right customer. And that's where that analytics engine that Debraj and Ken talked about before is super important. So that's another facet of, if I'm in a field-facing team, how do I not only work across all the different types of field engagement roles that exist in my organization, but also how do I leverage the insights and the content that is being generated by my partners internally, and that can help make me more successful. So I think that's some of the evolution that I see, and I think will continue to be there. But anyway, Ken or Debraj, please feel free to weigh in too, because I'm sure you have more to say.
I agree with the word amplification. Amplification is it's a multiplying factor, and the interesting thing I think there's a little bit of a dichotomy in the industry where it's, do you use AI and machine learning to be able to dictate next best action, or do you use that in order to equip the rep, who we in our organization see as the center of that universe, and allow them the freedom to pull in things and use what they want. And hopefully over time, what you do is through analytics, you show individuals the value of their actions, right? So at the end of that process, you start to see those who used more various channels, different content, who addressed content specifically to either objections or other things, they tend to see better outcomes. And so the question is, from an organizational standpoint, where is the belief or the philosophy in the best way to approach that? And you're right, because everybody's sort of on this journey, and so some people may be just getting into it, other ones may be deeper in, and they've already bought into certain ways of working. But what I try to do and think about is from an evidence base. It's saying, okay, I may have been in the field for a number of years, but at the end of the day, I want the analytics individuals to show me what seems to be working, and then let's take the feedback from the field and use that to keep iterating.
Good. Raj?
Yeah, and just to build on that, I would say, look, the customer-facing role is always going to be super important. I think it's how the organization shapes that role. Because, at the end of the day, we call it customer-facing for a reason, because this role actually sits in front of the customer and provides that end-to-end customer journey. And I think what's important is that to recognize that the number of channels that the customer-facing teams have today have expanded. And I think that's a powerful set of tools that a rep has right in front of the customer, because on top of the face-to-face visits, which used to be there, now the rep can send an email, the rep can do a remote detail, the rep can direct the customer to a content on a website, the rep can spearhead a webinar, and there are all these tools that's in the armamentarium of the rep. And I think we have seen, in terms of evidence across different geographies, and this is a research we did internally in the past, that the rep-driven channel always has a higher engagement rate. So if you take emails as an example, we have seen that a rep-driven email has an open rate of up to 60 to 70%, right? Contrast to that, a headquarter-driven email has an open rate of 10%. A third-party email has an open rate of 3%, right? So it just goes to show that, what's important for the customer is not just that, and it may be the same piece of email content, but what's important for the customer is who's sending that email. The name of the sender and the relationship they have with them actually triggers them to open that email and to have a greater engagement. So I think there is a significant amount of training and capability building that all of these roles have to do. But I think once that's done, and once the customer-facing team is bought in, you have a very powerful set of experiences that you can create, and nothing can replace that.
Yeah, and it's interesting because I have always thought of that customer-facing roles have kind of owned the customer experience, right? They've carried around in their heads all those things that we've tried to build into that single view of the customer, and almost replicate their knowledge level in order to provide things that benefit them. When the work we've done at DT in terms of measuring customer experience, it's just over 50% of the interactions have still been that face-to-face experience with customers. I'll throw the last 12 months out the window a bit. But I think that traditionally that's, we're going to get back to somewhere near that. Maybe it'll be 40% instead of, the 55 that was there historically. As that shifts though, what's the change that's impacting the customer facing roles? Are there new skills that are needed there? Is it just the trust skill that they need? What is it that you see as the differences there? Ken, I got a laugh out of you, so I'll make you go first.
Which one of us?
Go ahead, Ken.
Okay. The trust is a really big thing. I think, and I think it's helping them understand what. I think it's three things. One, building tools that are simple and clear and easy to use for them. It's not overwhelming them with too many choices. It's like buying a car. If you go on a website or someplace, it's almost paralyzing when you have too much choice. So I think it's spending the time to refine what's there and having them then understand that. And I think part of that is actually the management teams really owning this and understanding the value so that they can, encourage people to use it. And then the last piece is really showing them when it works. I mean, one of the biggest tools I think for us was when we first started down this journey was being able to show the difference in regions and watching them move up the ladder as they adopted a broader range of those things, and they understood that they needed to use them in a more thoughtful manner. So for me, I think in a way it's a new skill set because it's accepting that it's not just about what my personal relationship is with a customer. It's that I can build on that by looking at other resources and other materials to really understand a much more robust picture of who my customer is.
Good. Narissa, anything to add in that role, the role development in the customer facing?
Yeah, I think the only other thing I would say is when we say customer, it's not a one size fits all, right? Our customers are also on various levels of change and what they need and what they are looking for. And I think that's one thing that I do believe is helping and will continue to help our field organizations get more comfortable with this new model, because at the end of the day, their number one priority is to help the customer achieve what they need when it comes to the product or the service they are providing. So I think that's a critical driver. And I think to that end, look, I mean, I cannot imagine there's any field-facing team that's sitting out there that's not going through the mental math of COVID's been a reality now for how long, and likely going to continue into 2022 for some part. And so you're talking about sustained change in how your customer base wants to interact with you. Yes. It's just been a long enough time period that people are trying to learn and develop new habits. So I think that's an important part to lean into when you are trying to work with your field teams, is really helping them understand what's in it for them and reinforcing the criticality of their role, but really showing them that, the breadth of the customer experience they have to manage is now varied. And so they need better data, they need tools, they need incentives. So that I know that's something that we haven't talked about, but that is also important in terms of helping our customer facing teams build that ability to really interact in this, I would say, very dynamic model.
Great. Debraj, your thoughts there. And if you want to talk about compensation, I do want to get to this last section. So I'll let you maybe have a word about compensation or aligned incentives if you'd like, or to finish off this conversation.
Yeah, just to add on to what Ken and Narissa already said. So I think the key thing, with the role of the customer-facing organization is the realization that, we've spoken about data science and advanced analytics. I mean, when you do a data science project on customer interactions today, the bulk of the data is going to come from your CRM, because web is not a lot. We don't have so much traffic on pharma websites today. Anyway, we have a fragmented landscape. Remote is just starting. So the bulk of the data is CRM. So I think there's important realization from marketers when they do analytics on top of that CRM is that it's important to understand that the customer-facing organization is collecting customer data. And traditionally, we've used customer-facing organization for push messaging. We have not used them so well in collecting insights from customers. And that's becoming extremely important, because it's a notion of garbage in, garbage out. If your customer facing team doesn't think that you are really looking at the data that they're collecting on the field, then they're not going to take that seriously. So I think there's a change management component there. And I think when it comes to incentive compensation, there's an important realization there as well in terms of how do we incentivize the rep. And I think we've had long and hard discussions in terms of the traditional model of face-to-face interaction and the compensation model has been evolving over a period of time. But then how do you incentivize a rep for digital interactions, right? How do you incentivize them for sending an email or having a web interaction or having a remote interaction? So I think this notion of, are you compensating for input? Are you compensating for outcomes? And how do you blend that is becoming an important realization. So I think compensation in the multi-channel or omni-channel world has to evolve to take into account the totality of the interactions that the rep is having.
Great. So I'm going to push us. We have 5 or so minutes left, I think, here, guys. But so not a lot to talk about this organizational alignment. But Narissa, you and I spoke about how tech is being integrated, and with the advent and introduction of so much tech-focused or health apps for our patients as well as the providers. How is that role integrating into the organization? Because it really affects the people in marketing, the people in analytics, and the customer-facing roles. Maybe you can take a shot at that puzzle and how we're handling it.
Yeah, I mean, I think what I've seen is thinking about tech in 4 different areas. One is helping to identify appropriate patients for your therapy, and that's really things like working with EMR partners or diagnostics, and I'm sure Ken has some experience there in terms of actually identifying the right patient, so helping our customers really get to who needs to get access to therapy as quickly as possible. The second, and this is something that I've seen in my own personal experience, is really helping the patient have a better conversation with their provider. So, I think there are many diseases out there that are asymptomatic on the surface, but there are some symptoms that might take, that you do see some improvement. How do you help the patient? You show up at the doctor's office armed with information that can help improve that conversation. So things like symptom trackers or, tracking your mobility, maybe your cholesterol levels, things like that. Adherence is another area. We know that it's hard to get a patient on your therapy. Maintaining that patient, I think there's a lot of data that shows at the 3-month mark, you see a significant drop off in chronic therapy adherence. How do you help incentivize the patient through appropriate adherence programs? So that's another area where you have a lot of apps and patient reminders. And the last is outcomes, I think, and that's where I see more in the clinical trials. How do you develop your clinical trials with some of the wearable devices or apps that can help really track some of the outcomes that are important to patients, so they can see meaningful change beyond some of the efficacy information that we see in our labels. So those are things that from a customer experience matter. And I think building that into your customer experience journey is important, because then whether you are a marketer, a field person, someone engaging, with the customer, you can then help show up as more of a customer experience focused company than a product focused company.
Great. Debraj, I think you're doing some of this work now with some of your own companies as well. So what's your take on this integration?
Yeah, no, I think Narissa said it very well. I think this integration is absolutely critical. And then more often what I'm seeing is, there is also integration on the platform side, right? Because if the systems don't speak to each other, this is really, really creating a fragmented landscape. So this is absolutely important that, you have systems that speak to each other, you have teams that work together. And, we have the notion that the brand plan has evolved from being a marketing plan to a plan that is co-owned by marketing, medical, market access. But now you're adding sales to the mix, because you can't create personas and customer journeys without sales having that buy-in into the process. So more and more, the key functions are getting integrated, and everyone needs to have that seat in the table to have that unified customer-centric view.
Good. And Ken, what are you seeing? You've got 2 different indications and then something new going on as well. Yeah, go ahead.
I think Narissa actually did a really nice job of kind of encapsulating those things. The only other place I see technology coming in is where we have the opportunity with either our internal customers. So helping, whether it's the field sales force, the reimbursement teams, other things, helping them to understand what the customers. I can't remember if Debraj said it, but the idea that it's a variable set of inputs, and if you're in front of a customer, you have to meet them on their own terms and in the ways that they want to be. There are a variety of things that are, whether it's IDing patients or helping them with their experience, it's also, people want to receive SMS text. They want to, engage in different ways. And so we're trying things, I think, to see what will stick ultimately. But yeah, sorry, I'm rambling. I'll shut up. I think what she had said, it really encapsulated most of it.
Awesome. Time-wise, I think we're in the point where I should probably go to questions. So I'm going to do that. There's one that I had kind of myself that maybe we can work this into some of your final thoughts as well. So I'll give you a minute, but I'm going to go to the other questions. The one that we haven't really talked about is what's working in aligning your senior leadership to achieve the culture shift that's required, right? There's a lot going on. Can you mention the senior buy-in? I'm going to go. Can I just get one comment from each of you on that and what's working for you, and then we'll still be able to hit a couple of these questions.
Yeah, I think for us it was it hasn't been like a flip of a switch. It's been having somebody, whether it's our CEO or the person who runs North America, those individuals bought into it. They believe in it. And I think part of it is evidence-based. Part of it is understanding that we need to continually evolve. And I think we've all said this, COVID just massively accelerated the sport. I don't think we would have been as able to survive and prosper during COVID had we not already been on this journey ahead of time. So I think having their buy-in all the way down, especially like field sales leadership, marketing leadership, they show up at the same functions, the same things, and they talk together about the same outcome that they're hoping to achieve, and they do it by working together.
Great. Debraj, what have you seen that's worked?
Yeah, no, I think the change management mindset is extremely critical especially when it relates to senior management, because there is only so much that you can throw at them. So the important thing is to take them on a journey together with you, understand their language and speak the right language in terms of bringing them along, and then use interventions. I think some of the programs that I have seen personally in the past that works very well is making them champions of the transformation, where their own functions or their own teams are part of it. And then you come in as head of digital or head of ComOps, and you're trying to support the organization. The other thing that works, and some organizations are doing it, is reverse mentoring. Some of the senior leaders are telling us that, look, I have grown up in the times of the rep journey, and I don't know much about digital. So you assign to them a young mentor who's a digital native, and they meet them once in a month, and they learn something new and cool, and they get excited about all the stuff that they are picking up. So I think there are non-threatening ways of taking senior management on the journey, and you find that you can often make very good champions out of them, and then they're completely turned around and they drive the transformation, and you just play a supportive role.
Great. I think that's crazy to think our senior leaders are going to learn something. Ahead,
ultimately, if you tie it to revenue, you get a lot of buy-in as well. Just simply.
Did you see all the senior leaders just hang up on us? I'm sorry. Go ahead, Narissa.
I actually, Ken articulated what I was going to say. I think it comes down to also showing the benefit, right? So I think Ken talked about this a lot. It's really proving the hypothesis, and I think we're starting to see a lot of data that shows that it does change, and so I think that helps with the buy-in. I also agree with Debraj about really bringing in the people on the ground to be part of the change. It's hyper important, because that's actually where the change needs to happen. You have to get the people in the trenches to really believe it, feel it. So I think that's the second. And then the last thing I would say that I think does help with the change is hiring and actually bringing in outside perspectives and really mixing up the shape and the look and feel of your team. So and how that does then drive new ways of thinking and leaning into ultimately not what we want as a company, but what our customers are telling us we need.
Yeah. And I think what you said and what Deborah's, it fits together, right? If you hire someone with a different skill set, you should then listen to them also, right? As opposed to indoctrinating them into whatever you used to be doing. And I think that's a big fault of us. And I know I have failed in that experiment myself in my career. So I think it's a great lesson for us to take forward. All right, let me flip to some of the questions here. Here's a good one. What do you see your customers evolving at the same speed as your companies? And how do you make sure you continue to fulfill their needs? And
I think what I've seen is sometimes customers are evolving even faster than us. I mean, if you take a hospital system, and if you look at how many digital systems they have, and doctors are using iPads, and what kind of interactions they're having, I think sometimes you find very progressive accounts that are really up there in terms of how they've evolved quickly and pivoted on the digital side. So I think customers are always evolving, some slower, some faster. But I think it's always important that we understand how that evolution is happening. And each clinic, each hospital, each health system is quite different. So it's important to understand how the needs are evolving. In fact, from a consulting side, I can say I was speaking to one of the clients yesterday, and he was saying that they do run continuous analytics. And one of the interesting insights they've had is during the pandemic, a lot of doctors wanted to get messaging on WhatsApp. And then they redid the research 3 months later, in fact, now, and the insight that came back was that doctors are really tired of WhatsApp. They want to go back to email. So it's very important to understand how that pivot and shift is occurring, because it's happening all the time. And I think analytics and understanding customer needs is an important thing that you have to do on a continuous basis.
Narissa, let me flip to another one because I'm looking at the clock is running out. What's your assessment about what your customers' excitement have been around omni-channel interactions in this COVID or post-COVID world? Are they excited about it? Yeah.
Well, I actually agree with Debraj on this. I think it's varied. I think some customers, because again, they're not just a customer of healthcare, they're also a consumer in their daily life and want to do more and want to interact. So there are some customers that are very much on, I love this, this is moving in the direction that I want personally. But I do believe there are some customers that still like the old way of engaging and want it and need it to continue to happen. And so for me, I think it's a mixed bag. And I think that's the challenge we're faced as an industry today. Is it's not just one way forward, it's how do you build for the varied type of interactions. And I think my personal opinion is part of the challenge is, as an organization, because of COVID, that acceleration and the variability of the customer need is such a big step change that we are trying to do our best to catch up when it comes to systems and capabilities, which is so critical to be able to enable that ability to interact with the varied reactions that we're seeing from our customer base. And then also with certain geographies, because some geographies are more heavily leaning toward more face-to-face, some geographies are more heavily leaning toward more virtual. So it is a challenging time right now for us to be able to pivot to those different models.
Great. And one last one, Ken, you used to manage that incentive compensation process for me, and you've been on the sales side of it and the headquarters side of it. Is there a better way to make that a unilateral, marketer, analytics person, and customer-facing person having a similar incentive structure?
If I figure that out, I'll probably go start my own company.
Can I come? Yeah.
You know what I think it is just keeping part of it is the psychology of incentive comp, right? It's so having things that actually matter to people. You mentioned earlier about building in elements of use of technology and things like that. So, you can always use MBOs, you can use things like that. I think the hardest thing is to link the headquarters-based incentives to the field ones. I mean, ultimately, we're all trying to cause the same thing. We're trying to have good outcomes with patients, and we're able to function from a profitability standpoint. I don't know. I don't know that I have a good answer for that. I don't know if Debraj or I maybe punted on this one, but I think part of it is trying different things out and figuring out what's moving along that pathway. Because at the end of the day, people in the field are motivated by, largely by what their bonuses are and what their income. But it's also, I think it depends also on the therapeutic class too. The relationships, the conversations they have, all those things are a little bit different. I'd turn it over to my colleagues. Say
Well,
it.
maybe if I may, because I thought about this too, and I think I agree with you, Ken. It's a tough one because I actually don't know that it's just about aligning incentives across functions or internal versus the field, because I actually think you want to align incentives to what you're trying to get that particular individual in that role to do, which is very different based on the conversation we just had. You know, to me, the analogy I think of is, you know, losing weight, right? We might say that we want as a group to lose weight, and that's the ultimate goal that everyone's aligned to. But the actions you have to take to lose weight might be very different depending on what you know, who you are and how you approach it. And so I think the challenge and the opportunity for us is, how do we incentive the marketer, the selling rep, the EU rep, the account manager, and it has to be unique to their particular situation, because otherwise you're going to have, you know, incentives that are so broad and tough to drive the action you want. So I agree with you, Ken. I don't see it being a one size fits all.
I think we're going to have to make that the last word. So listen, all three of you guys, thank you so much for the time. You know, y'all put in time ahead of this as well as this morning. So I think it was an interesting 45 minutes. Hopefully our audience thought the same thing. But I really appreciate your sharing your thoughts on the subject and how this roadmap is going to look for all companies in the future. So thanks, everybody.
Thanks for the dialogue, John.
Thank you.